All right, so we're going to treat your ankle, and it's your right ankle, and it has quite a bit of swelling. You can tell in the back here that it's pretty swollen. You can barely see. Nope, actually, you can't even see your bone. Nope. Your ankle bone. It's pretty swollen there. Okay, so this is going to be your first treatment, and the name of what you have.
I have a contused talus bone. So
contused talus bone.
The bone itself has a bruise covering about 30% of it.
Okay. All right, so here we go. I'm turning it on. It's set for 3 minutes. Since I know I could pretty much take you up to the lodge, I'm just going to turn it. Can you explain if or what you feel, if anything?
Like a tingling and a vibration.
Okay, a tingling, and is it through your whole foot, through the back? Does it feel like it's hitting the area that's in pain?
It does a little bit. It's kind of starting to flicker now on the lower part of the ankle. I feel it a lot on the arch of my foot. And,
okay. Is that a good area because there's different areas that when you place this that you can actually direct the pulse to go, and that's what we're going to do here throughout this throughout the treatment is move it into different areas of your foot. So we're going to, like right now we're actually going from your heel through, because that seems like that, okay, yeah. And then the next one is we actually have a hose that we can wrap your complete ankle in. Go ahead and keep the heel on the ground, and then actually, yeah, move the toes. Do you feel anything happening while you're moving the toes?
It's kind of starting to like twitch up my leg and up my shin and up my calf. Like I can kind of feel like
now
that.
One of the good things that happens with this is, okay, that was the first 3 minutes. I forgot to ask you before we started, what was your pain level at, you think?
Probably a solid 7.
Oh, good, solid 7. Okay, do me a favor. Why don't you go ahead and do you feel anything different? Go ahead and move it around. Do you feel any relief?
A little bit, yeah.
Okay,
but
so
it's not locking as much as it was.
Oh, really? So in 3 minutes so far, we were able to remove some of the locking. And we're going to do it this way now. Actually, let's go to this side because. Okay, tell me when you feel it.
Feel it.
Okay, do you feel it hitting from a different perspective now?
It's more coming through the side now.
Okay. And you can take...
Yeah, that's fine.
Okay. So in the first 3 minutes, you did feel some type of relief.
Yeah, I did.
Is that impressive?
Can
you take a pill? I mean, we're just starting, and you really don't know much about this or its treatment. But do you think that's? I mean, how long have you been going to the doctor for?
3 months.
For this, for 3 months, and it seems like it's getting progressively worse. Then.
Yeah, it is.
Okay, so it's getting progressively worse. Doctor hasn't been able to do anything for you.
No, I'm told I need surgery. So.
Okay, and then what would the surgery? Oh, you said they were going to
do an actual partial ankle replacement.
Partial ankle replacement, and you said that would be putting in. Is it bone from another cadaver? Okay.
So they'll drill holes in the actual talus bone to improve the blood flow and oxygen flow to the area, and then they'll replace the part of my bone that is contused with other bone.
Okay.
And it won't be like the nice orthoscopic one. It's like almost a reconstruction. So.
And so you had mentioned that this is kind of related to your past of being in gymnastics.
Yeah, gymnastics, diving, cheerleading, constantly having the
so sports.
Exactly,
yeah, sports related.
Yep.
There you go.
And ran track too, so I'm sure that didn't help. See,
well,
exercise is bad for you. No, I'm just
well, you'd be happy to know about 2.5 hours ago, I was in Mission Bay, wake surfing, and I had my turn, and on my first pull out of the water, I pulled my hamstring.
Oh no!
And so, fortunately, I was one of the last ones that was going to be pulled for the morning group, and then there's an 8 o'clock group that comes in. That I was able to run a Coronado to get the machine. And I feel about 80% better on a muscle pull on my left hamstring. I was limping when I got there.
Oh, no.
I could barely walk, and now I can do a squat with just my left foot only. I mean, that's incredible. Okay, so boy, do you notice anything, or is that, does it seem like just in this area? We haven't even done this area yet, but do you notice that right there? Because the bone,
about the same to me, but
really
you're a lot
okay.
Closer to it though.
Yeah, because this bone, it seemed like it was more swollen underneath here.
Could be.
And I'm starting to pull it. Let's pull out. We're going to do that other side where I'm seeing the. Now go ahead and move your foot around. Do you feel any more relief? Is it about the same
About
or
the same? Yeah.
about the same? Okay, let's go ahead and put it through. Okay. How does that feel?
That feels like, now you're getting it.
Okay. Now that's what's going to happen when we wrap the other one.
Now that I can feel it all the way through the bone.
Okay.
Yeah, leave it there.
Yeah. Does it feel good then? I mean,
it does, yeah.
It almost feels more like an internal massage, doesn't it?
Yeah, it does. It really does. I mean, it's kind of one of those things, like, it's a little uncomfortable, but in a good way, if that makes sense.
No, it does. Everybody's face that I've been recording on this, they look like they're in pain, but they also look like they're in pleasure.
Oh.
It's the weirdest thing. But you know what's funny is we've been doing this around dogs, where I actually treated my own dog. She's 13 years old and could barely walk.
I'll just have like hip dysplasia.
No, she's a little toy poodle, so her paws are real sensitive and weak. She wobbled when she would walk. I did only one 3-minute treatment on her, and she went running across the kitchen floor like nothing. And you know how the little poodles, they actually like drag their butt around? You probably see it in cartoons.
Yeah.
She hadn't done that in years. And she's
funny.
able to do it now again because she could use her front paws to pull her along. And you said your left foot is
it's
starting.
Yeah, it's like
okay. Let's
where
go.
This one was like 6 months ago. This one is now.
All right. How does that feel? Would you want to stand
Did you
up?
hear that pop? Yeah, I can tell the difference.
You can tell. Okay, so you were at a what? You said a 7 or an 8 pain?
Yeah, and I think definitely the swelling behind the ankle. Is
yeah. I mean, you can.
Right. You couldn't see that.
Yeah, it wasn't indented. It was more puffy. And what do you think your pain level is now? So if you were at a 7 or 8,
probably like at a 5. So I mean, it's definitely.
Okay. So I mean, that's losing 3 points of pain in just a matter of minutes.
Yeah. Like this is the best I get with the naproxen, the medication.
Really?
This is the best.
And how long does that take for the naproxen to work?
A couple hours.
Couple hours.
It's a 12-hour, pill, and I only take it when I absolutely can't.
Okay, so this is natural, no side effects as of yet that anybody's been able to figure out.
Yeah, that actually.
Yeah, you hear that popping? That's actually pretty good. I heard that one.
Well, that's what that's what it does.
Oh, is that what it does? Oh, okay.
Yeah, it pops.
No, because a lot of times when I've treated people with the ankle, it releases their pressure and. Okay, well let's keep treating.
Yes, let's.
Good.